Snoring. It's serious. Are you snoring your way to ill health? International Sleep Day is just the time to talk about sleep and its nemesis, snoring. Hi, this is Dr. Amrita, and you're listening to the Health Wealth Rich podcast. Snoring irritates others and disturbs your partner's sleep too. But did you know when you snore, it affects your heart and all your systems? A health survey conducted in India showed that 22% of the total population self-reported having a snoring disorder. OSA or obstructive sleep apnea is highest in the age group of 50 to 59. Males are affected more than women. With blocked nose or cold, occasionally some people or even most may snore. But if you are a chronic snorer, I have some questions for you. How long have you been snoring? Do you feel sleepy and have low energy every morning? Did it start suddenly? Are you overweight? Are you hypertensive or diabetic? The problem with a small sound like snoring is it grows to be a problem if you don't tackle it first. The good news is early intervention is useful in many cases. Bad news, sometimes even surgery may be needed to help you on the way to health. Snoring can happen in different grades when it causes sleep apnea or hypopnea. You need to worry when it's serious. But how will you know it's serious? OSAH or obstructive sleep apnea hypopnea syndrome. It's a serious condition, and it is important for you to know that with severe snoring, your airway closes and your cells and organs, including your heart and brain, function without oxygen during that time. The problem is you don't know whether you are having this problem. Your doctor listens to your symptoms or clues and may ask you to do some tests. What is apnea? It means complete breath holding for 10 or more seconds. Hypopnea means partial breath holding. What are the symptoms of sleep apnea? Noise through nose and mouth during sleep, also known as snoring. Fatigue. You can witness the breath holding. Gasping or choking while waking up suddenly. Fragmented sleep, unrefreshing sleep, reduced alertness, poor quality of life in general, mood changes, nocturia, and EDS. That is excessive daytime sleepiness. Risk factors for OSAH or snoring. Male gender, obesity. It is also associated with cerebrovascular diseases, diabetes, hypertension, hypothyroidism, alcoholism, smoking history, any history of tonsillectomy or adenoid surgery in childhood, shift workers, and history of road traffic accident. Danger signs for OSAH: BMI more than 28, neck circumference 43 cm is predictive, nasal problems like nasal valve collapse, stenosis of nares, deviated nasal septum, inferior turbinate hypertrophy, polyps, craniofacial abnormalities. What are the tests for OSAH? The gold standard for testing is in the hospital. Usually, a polysomnography is done. It includes an assessment of respiratory oximetry and sleep architecture. Assessment uses EEG, EOG, and EMG. Imaging, endoscopy, blood workup are all needed. The treatment options you need are dependent on the condition causing the snoring or OSAH. Your doctor will be the best person to have a tailor-made situation for you. The lifestyle modification which generally helps are a good diet, which will reduce your body weight, exercise, and good sleep hygiene. CPAP or continuous positive airway pressure helps to keep the airway open and prevents apneic events in people with snoring. Snoring aids like mandibular advancement devices, special pillows, nasal dilators, air purifiers, and humidifiers can all work depending on the case. The working is variable. Surgery is needed in some cases. Snoring aids, do they work? A nasal dilator will work in someone with a narrowed internal nasal valve area, but this is possible only after you find out the cause of the snoring. People with positional snoring, most common is in the supine position. A wedge pillow, a realignment pillow, and a side sleeping pillow can help in maintaining proper sleep posture and is often helpful. Mandibular advancement devices advances and brings your lower jaw forward. This makes the tissue tighten and helps prevent snoring in some cases. It's best for supine snorers, overweight people who have started snoring later in the age. Age-related worsening of snoring can also be helped with a mandibular advancement device. What is the best course of action for you will depend on the underlying condition which causes snoring in you. But if obesity is the cause, you have hope. When you lose weight, you can definitely get rid of the snoring. You should get help from an expert on time. This is an information only for awareness. As healthcare information is constantly updated, this podcast and the associated blog posts are not meant to be a replacement for a doctor's consultation, nor is it a medical recommendation or treatment. You were listening to Dr. Amrita on the Health Wealth Bridge podcast.